Ocuvite Eye Multi is a combination of vitamins and selected minerals used to prevent or treat vitamin deficiency. This could be due to poor eating habits, problems absorbing nutrition from food, increased need for vitamins and minerals due to stress or illness. The vitamins and minerals in this combination are essential for the body to function well. It contains high levels of B vitamins, vitamin C, as well as other vitamins like A, D, and E, along with minerals such as zinc. It does not contain iron and has only a small amount of calcium. It is not recommended for treating anemia or preventing osteoporosis. It is important to take this medication as directed by a healthcare professional and to consult with them regarding the best timing and daily dosage for your specific needs. When taking Ocuvite Eye Multi, it is recommended to take it by mouth, either with or without food, as instructed by your doctor. This is typically taken once or twice a day. If you experience stomach upset, it may be helpful to take the product with food. It is important to note that if you are taking certain antibiotics, such as tetracyclines or quinolones like ciprofloxacin, you should take Ocuvite Eye Multi 2 to 3 hours before or after taking the antibiotic. This is because the minerals in the product may interfere with the antibiotic, making it difficult for your body to absorb it. Some common side effects of Ocuvite Eye Multi include nausea, stomach upset, diarrhea, flushing, and an unpleasant taste in the mouth. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it's important to inform your doctor immediately if you experience any serious side effects, such as mental or mood changes, or unusual weakness. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as a rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, and it's important to contact your doctor or pharmacist if you notice any other effects not listed here. As for the optimal timing and dosage, it's best to follow your doctor's instructions. Typically, Ocuvite Eye Multi is taken once a day with a meal. And always consult your doctor for any concerns or questions regarding this medication. Before starting Ocuvite Eye Multi, make sure to let your doctor or pharmacist know if you have any allergies to it or to any of its ingredients. Talk to your pharmacist for more details about any inactive ingredients that could cause allergic reactions. Also, be sure to share your medical history with your doctor or pharmacist, especially if you have low blood count, high calcium levels, kidney disease, or liver disease. This medication is not recommended for children under 12 due to the risk of harmful levels of vitamins and minerals building up in the body. If you are pregnant, only use this medication if clearly needed and discuss the risks and benefits with your doctor. For breastfeeding mothers, consult your doctor before using this medication. As for the daily dosage, it is best to take Ocuvite Eye Multi as directed by your doctor. And it is recommended to take it at the same time every day to help you remember. It's important to be aware of potential drug interactions that may change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ocuvite Eye Multi include altretamine, cisplatin, levodopa, hydantoins, such as phenytoin, methotrexate, and pyrimethamine. Always consult with your healthcare provider before taking this medication, especially if you are taking any of these other medications. If someone has taken too much Ocuvite Eye Multi and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Overuse of this medication may lead to symptoms such as nausea or vomiting that doesn't stop, dark urine, stomach or abdominal pain, yellowing of the eyes or skin, back pain, painful urination, changes in the amount of urine, bone pain, mental or mood changes, and severe headaches. If you experience any of these symptoms, it's important to seek medical help right away. Make sure to keep all your medical and lab appointments. While it's important to try to get your vitamins and minerals from healthy foods, sometimes it's not always possible to get enough from your diet alone. Ocuvite Eye Plus Multi can help fill in the nutritional gaps to support your eye health. It contains B vitamins, including folic acid, which are naturally found in leafy greens, vegetables, and citrus fruits. Folic acid can also be found in enriched grains such as bread, pasta, and cereal. The recommended daily dosage is 1 tablet taken with a meal. It's best to take Ocuvite Eye Plus Multi at the same time each day to help you remember. This can be in the morning, afternoon, or evening, whichever works best for you. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next one at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing Ocuvite Eye Plus Multi, make sure to keep it at room temperature and away from light and moisture. Remember to store all medications in a place that's out of reach of children and pets. If you have any leftover or expired Ocuvite Eye Plus Multi, don't flush it down the toilet or pour it into the drain. Instead, make sure to properly dispose of it. You can consult with your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.